Welcome back, Jennifer here. Today we are cracking the code on the SLUMS Cognitive Assessment. Ever wonder what speech therapists use to determine a person's cognitive performance? Like, how do we know someone isn't functioning at a normal level? Well, the answer isn't simple because there are a ton of different assessments out there, and they're going to look at different areas of the brain, such as attention, orientation, memory, calculation, reasoning, judgment skills, and even language. Now, these areas are then recorded together to determine a patient's overall cognitive score. Some of these assessments are what we call formal, meaning they have data to support the conclusions, and then others are known as informal, meaning they are content and performance driven. Now, since I work in a skilled nursing facility, I rarely have the time or resources to administer a formal cognitive assessment because these type of tests require a lot of time, usually 1 to 2 hours, and they also cost a lot of money. So I use what's known as informal assessments or screening tools to determine if a patient needs therapy. These quick tests can help me discover the presence of cognitive deficits, or they can allow me the ability to identify changes in a person's cognitive behavior over time. Now, these assessments are relatively easy to administer. In fact, you could give them to your loved one. But the skill comes and the knowledge comes from the ability to understand what the score means and how to develop treatment for a particular patient. Okay, so today I wanted to read through the SLUMS Assessment, which stands for the St. Louis University Mental Status. This is the tool that I used most often in my facility, and it was developed to identify mild cognitive problems. So I will read through the questions, and then I'll also display them in text on the screen so that you can see them. Feel free to answer these questions yourself. Let's see how you do. What day of the week is it? What is the year? What state are we in? Please remember these 5 objects. I will ask you what they are later. Apple, pen, tie, house, car. Now, I would have you recite those words back to me, and I make sure that you have all 5 memorized before I move on. I will read them one more time. Apple, pen, tie, house, car. Okay, now let's say that you have $100 and you go to the store and buy a dozen apples for $3 and a tricycle for $20. How much did you spend? How much do you have left? Now I'm going to have you name as many animals as you can in 1 minute. You can begin. Time's up. Okay. Now, what were those 5 objects that I asked you to remember from earlier? Next, I'm going to give you a series of numbers, and I would like for you to give them to me backwards. So, for example, if I said 4, 2, you would say 2, 4. 8, 7. 6, 4, 8. 8, 5, 3, 7. Okay, now I'm going to have you draw a clock face. I would like for you to put the hour markers in the circle of the clock, and then I'd like you to designate the clock hand to represent the time 10 minutes to 11 o'clock. Now, looking at these 3 shapes, please place an X in the triangle. And then tell me which of the figures is the largest. Now, last thing I'm going to do is read a story. I would like for you to listen carefully because afterwards, I'm going to ask you some questions about it. Jill was a very successful stockbroker. She made a lot of money on the stock market. She then met Jack, a devastatingly handsome man. She married him and had 3 children. They lived in Chicago. She then stopped work and stayed at home to bring up her children. When they were teenagers, she went back to work. She and Jack lived happily ever after. Okay, first question. What was the female's name? What work did she do? When did she go back to work? And what state did she live in? And that's it. How'd you do? Don't worry yourself if you missed a question or two. Most normal functioning adults will. In fact, on this test, missing up to 3 points with a high school education is actually still considered within normal range. I will leave an attachment in the description section below on how to score the assessment. And in an upcoming video, I want to read through the Montreal Cognitive Assessment, also called the MOCA, which is another brief test that I use to determine abnormal cognitive function, just so that you can compare the two. See you all again in a couple of weeks. Thanks for watching, and until next time, good luck cracking the code.